When we find ourselves in pain, we're often looking for really short-term strategies to try and make ourselves feel better. And I totally get it. I've had so many back issues where I feel nice and stiff in the morning and I'm struggling to bend forward. And all I want is a nice pair of hands to get into that lower back and to make myself feel better. The trouble with this is that you're focusing in on just whatever's showing the symptoms. And we need to try and find out how that's occurred, what's happened there. Now, at Injury Reactive, we don't just focus in on the pathology. So for example, that muscle strain or that joint problem in the lower back, it might be showing us that, but how did we get there in the first place? Now, the body can rotate, it can side bend, and it can move forward and back. And those three motions there are how we develop entire motions. And when one isn't working as well, often the others have to pick up the slack. And this is where we find ourselves having problems. So let's take the knee, for example. We've got a patella tendon right at the front, just underneath that kneecap. That's really easily injured, especially in runners that are overloading their training, going from, let's say 5 miles a week to 20 miles a week. We can often pick up issues there. But bigger than that, bigger than the training volume, how well does that ankle perform? Does that ankle feel stiff and blocked? And does that mean, therefore, that the knee has to bend more to take up the slack? Now, if this is the case, that's how the patella tendon can get loaded even more so. So at Injury Reactive, we don't just focus in on the pathology. We're trying to look at the bigger picture. Not only are we talking about emotional stress and your training programs, we're actually trying to have a look at how well that human body moves in that entire chain. And this is how we get to the root cause of the problem and build your training plan. Once we figure out if we can fix that ankle and get that moving better, that's going to be a direct improvement on your knee. That's how it's going to get you better. Or how well does that soleus and those hamstrings work to slow down the knee? We might present with anterior knee pain, which is that tendon problem at the front, but it's often the areas in and around it that can lead us to that injury in the first place. So next time you find yourself injured, have a little think about that and go and try and find someone that's going to get to the root cause of the problem rather than just chuck on some ice on that tendon.